small towns to big businesses with insurance closing. Many also blame lawmakers' refusal to expand Medicaid, state aid for the
Expanding Medicaid would be a bad decision for the state of Missouri.
Kansas has also chosen not to expand Medicaid. Healthcare experts say the problem is rural hospitals, who often serve the poor and elderly, rely on Medicaid subsidies to survive. When the Affordable Care Act became law, the government presumed the uninsured would gain coverage through the new law or by state lawmakers expanding Medicaid. That hasn't happened, and now rural hospitals say they're in a crisis. But so do some lawmakers.
It's eating up more and more of our revenue. The question is then we either have to raise taxes, cut other services, not fund things like roads or schools.
Despite protests, Senator Krause says Medicaid costs in Missouri have skyrocketed to $8.5 billion already, 8 times higher than in 1994.
I mean, it's growing so fast, it's eating up every new dollar that the state gets.
But experts say these decisions are putting our health at risk.
When you think about those communities going without an emergency room, we've already seen some very sad stories.
Schmidt argues if we continue to lose rural hospitals, taxpayers will still end up paying.
People will put off the care because it's not local until they get very ill.
Or worse,
people are going to die.
Amy Holly, 41 Action News.
All right, now big hospitals like the University of Kansas Hospital and their specialists are working with rural hospitals to bring costs down. They're seeing rural patients through telemedicine. Now, your tax dollars spent